I am so excited to welcome Anna Blocker-Smith to today's discussion. Anna is the Director of Donor Relations at Huntsville Hospital Foundation, and I have had the absolute pleasure of working with Anna starting in August of last year, though they were a Pride client before then. And I'm so excited. Next month, we're going to be kicking off an opportunity assessment with her team to continue helping you all meet your mission and connect with your donors. But today, we're going to talk about one of the most brilliant fundraising events I've ever heard of. When Anna first shared this with me, I was like, this is just such a thoughtful way of presenting impacts and engaging your donors. And it was quite successful from a major gift standpoint. So today I encourage you to type in your questions as we go through this process, or as Marty said earlier, at the very end, we'll have a Q&A. You're welcome to unmute at that time and ask Anna directly. Today, we're going to talk a little bit about the purpose of this event, key goals of the event, engaging stewardship opportunities, impact reporting, and ultimately, like I said, it led to some pretty significant asks that were appropriate and meaningful and transformational for their goals as an organization. So before we kind of kick into the start, Anna, I just want to just celebrate you too. Anna is inspiring to me. She is so authentic in how she engages with donors, and her genuine approach to donor centricity, I think, not only is seen by her donors, but she oversees a team of other frontline fundraisers, and I can see them integrate that into their approach with their donors as well. So I'm inspired every time I speak with Anna, and I hope you all leave today inspired by her approach to interactions with donors. Anna, could you take a moment and share with us what exactly it means to be the Director of Donor Relations and how long you've been at the foundation?
Absolutely. And thank you so much for your kind words, Michaela. It's an honor to be with all of you this morning. And so, as the Director of Donor Relations for Huntsville Hospital Foundation, our team works with our individual donors who support our hospital system. And so that's from major gifts to annual giving, planned giving. And my role is to lead our team in all of those strategies, asks, key interactions with donors, and truly from the stewardship piece, communicating how our donors are making an impact within our hospital system, for our clinical staff, for our specialized programs, and the things we're able to do because of generosity and their investment in our community hospital. And so I've been at Huntsville Hospital Foundation for a little over 8 years. I came in as a major gift officer, and then our team developed and grew. And so I started this position in 2019. And it's incredible to see our team work and be challenged in the ways that we interact, engage, and ask our donors to come alongside us.
Well, thank you for sharing that, Anna. I asked you to kind of give us some context because everybody on the call today has a slightly different size organization, and so it's useful to kind of think through how we might scale for our own shops. So now the really exciting piece, I'd love for you to share a little bit about how you went about creating this societies event. Everyone, this is what the title of the event was. Could you start off, Anna, by explaining what the event was and who all was invited to this event?
Absolutely. So our societies of 1895 and 2012, we call that because our main hospital was established on that date, and then our second hospital was established in 2012. And so it's connecting back to when those hospitals started. And so this is a group of individuals who contribute at our major gift level annually at $5,000 or more. And so they are households that will receive an invitation to our annual event, and this takes place at the first of the year. So we can look back over the past 12 months and truly celebrate with them, share how their generosity has played a key role in what we've been able to do within the hospital, And so it takes place annually, and we really look back and then look forward to what we're able to do because of their contributions.
Great. Thank you, Anna. And can you explain to us, just like we're going to get into some pictures so people can really see what this looked like, but how you sort of changed this up this year? And I mean, it was a different type of event. And then, you change it up. How did you communicate that with your donors?
Absolutely. So for the past few years, this event very much was reception style. And so our donors would come in, we would have sort of a social happy hour time where they could interact with one another. We could go around the room and speak and talk with one another. And then we would have a program midway through in which they would hear from our hospital leadership, from our team. We would have some awards and really spotlight kind of from a stage perspective, everyone looking in one direction as to, okay, here's what we've been able to accomplish. We wanted to do something different this year. We knew our venue needed to change, and we weren't exactly sure what that would be. And years ago, we had dreamed about something interactive, something that would be different. Our donors knew what to expect when coming in each year, but we wanted to surprise them. And so when we set our venue as being at the Huntsville Museum of Art, initially our team was going, okay, how do we communicate why we're doing it at a museum? And how does that correlate and correspond with my impact at the hospital? And so as we started brainstorming, we thought, well, why does someone go to a museum? They're going to see galleries. They're going to see a story or interact with pieces of art. And so how could we create that with impact from the hospital, and for our donors to interact with and see firsthand the impact across programs, faces of gratitude. And so that's where conceptually we had to it was a cross-team collaboration. We brought in gift officers, our communications team, and saying, okay, if we were to create something like this, what would it be and how could we do it?
Yeah, thanks. When Anna first described this to me, I was like, it's an exhibition, but with the hospital's impacts. And then you took it to the next level and made it highly engaging. So I'd love for you to share a little bit about how your team, this was a team effort, as you said, really thought through how you're going to make it fun and interactive to really pull your donors into the space.
What we started calling it was our gallery of gratitude. We wanted them to step into an immersive exhibit of their impact. And so we broke it into 5 different exhibits within the gallery. And so from the moment the donors walked in the door, we wanted them to feel welcomed. We wanted them to know that there was movement in the room. And that they didn't have to stand in one spot. We wanted them to it to be fluid and go around and see different pieces. And so we from music being played by a hospital employee who actually works in our plant operations, but he's an incredible violinist. And so we had him playing music to we incorporated actual art pieces from our employees to show that they have creativity beyond just their clinical or operational roles at the hospital. We wanted donors to touch and feel. And so we were thinking about what are the experiences when donors walk in the door, not just from a welcoming face, but the first things that they saw, what did they hear? What things could they actually touch? One of our galleries, we work with our music therapist at the hospital where they record heartbeats for palliative care patients. And they put it to music for families to take home with them when their loved one passes. And they shared one of those recordings so a donor could pick up and actually put it on their ears and they could hear. We wanted our donors to even speak and communicate with the clinical teams or the program directors that were the ones that were beneficiaries of this generosity. And so they are the ones speaking. They're not just hearing from us as a staff team, they're getting to hear from people within the hospital. And so that direct interaction was key. And I think it made it fun and unexpected as our donors were walking in.
Great. Well, thank you for kind of outlining that. Now I'm excited. I'm going to move right into some of the photographs that Anna shared. I think this was really helpful in illustrating kind of how this operated. Could you walk us through some of these photographs, Anna?
Sure, absolutely. So one of our galleries was, we called it Innovation Fueled by Generosity. And so this is the section where we identify different pieces of equipment that our donors had purchased or supported throughout the past year. And so the one right here, this is one of our interactive communication devices that for our non-communicative intubated patients, they can utilize their eyes to communicate with the clinical team on this screen, and it communicates and for them. And so our staff member here was a donor would stand and they could utilize and look, and their eyes would move and they would be able to speak through this device. And so it's a really neat piece of technology. And so as they walked around in this one area, so it was spread out throughout the room. This is another piece of technology that touches our neonatal ICU, but also our staff through education. This is a simulation doll. And so our nurse educator is showing how she uses this technology to train our highly skilled neonatal nurses to care for our smallest patients. And so they were able to ask questions, and she could simulate different teaching techniques through the baby that was there in the simulation doll that was in the giraffe bed.
Right. What about this one, Anna?
So this was our spotlighting our programs. And so we have a lot of specialized programs that our hospital supports, and is fully funded through donor donations. And so this is one of our team members, our development officers, that is speaking to a donor and spotlighting our Canines for Coping program. We actually had a photographer come through. This was funded by a grant, and take these shots of our dogs in action. And so she's communicating not only a piece of art through the photography, but then she's able to, in person, in real time, face to face with the donor, share the impact that this program is making within the hospital doors and in the community. So it's just one of the ways that we tried to incorporate different like mediums and modes as they were walking through the different exhibits.
I'm sure I would head to the dog photos first.
They're so sweet. Everybody was very disappointed that we didn't have the actual dogs there. But it was strategic because they would have probably hijacked the show. And then another piece, and this is part of what do we already have on hand within our database? What have we shared throughout the year? What are patient experiences that we have spotlighted? We collected those. So we already had these grateful patient stories that we had spotlighted throughout the year. There are different modes of communication, but we wanted to put some faces and some quotes. So these are, we had 2 different faces of gratitude, and it went across different programs. We didn't want to only focus in on one area. We wanted it to touch, and we wanted the faces all the way from pediatrics to geriatrics to oncology, and then our community care clinic that goes out into the community, so that donors could see just the different faces that are a direct result of their generosity. And this is the unique piece. We have an arts and medicine program within the hospital, and this was truly key within when we were conceptualizing this event. So we have galleries within our hospital that are interchangeable, and we have a program director for that, but she helped us acquire actual hospital employee artwork, from photography to there was an acrylic sculpture, paintings, sketches that we were able to spotlight and showcase our employee talents. And these were from clinical staff, operational, financial, across the board, just playing off the theme of us being in a museum and also the gallery, but it humanizes, I think, for some of our donors, the employees that are working within our hospital doors each day. So we really wanted to platform and honor and celebrate them during the event.
Thanks, Anna. So I hope it was useful for you all to kind of see some of the photographs and how this was put together. This next part we're going to talk about is where I am just like smiling because it is really where you saw some major transformation in your donors' just excitement. Any questions for Anna before we go into talking about the major gift solicitations that came as a result of this opportunity? All right, great. Well, Anna, there are two donor families in particular I'd like to ask you to highlight. So as I said, I had the opportunity to start working with Anna in August last year. And one of the individuals that's on her team has had, we're going to just call them a toughie donor couple. We talked about them a few times. They're just a challenge to get involved and figure out what the right fit is for them and what the right ask is and the right way to present an opportunity to them. And you saw incredibly expedited movement with this couple as a result of this event. Anna, could you talk about that couple? How did this transpire? How did you follow up with them?
Absolutely. And so as we get RSVPs, so we know who's coming to our event. And so our development team will look and say, okay, who's coming in? Who are our key target donors? In which we want to ensure that they maybe see or experience different elements. We want to make sure that they go and they know this is where their impact is. So this donor family that was in attendance, they've been involved, engaged. They have high affinity, high capacity, but we just didn't know which area. We had presented a couple of different opportunities to them that was instantly shot down. But the wife had started to get a little more involved. And this is one in which we were so glad they were there because one, you get FaceTime, you get to start highlighting different areas that we are able to support and kind of say, what are they interested in? And it just so happens, this was not planned by us. It couldn't have been orchestrated any better. I think it's key who's at the event communicating the impact. So we had a new director that is over our Caring House program, which is our grief and bereavement, childhood grief bereavement program. And she was there and was able to connect with the wife. And then minutes later, the husband came over. The wife drew her over and she said, I want you to hear what she's doing. And she proceeded to tell the husband what was happening, what their goals were. And the husband said, what is your immediate need? And she told them, we didn't ask her to communicate anything. She said, we need a house, we need a new location. And so they exchanged numbers, and this is all happening without a gift officer being there. The program director intentionally comes to us after the event and says, this is a donor that I spoke with and that you need to follow up with. They are very excited, and it seemed motivated and connected to this area. Instantly, us as gift officers were thrilled. So our major gift officer who had this relationship followed up with them after the event, thanked them for coming, and scheduled an in-person meeting that very next week. And they were able to talk through the event, talk a little bit more about the program, and then invite the donors to the actual facility to walk through with the director. And they made a six-figure commitment to that project. And so we were thrilled. We didn't know if it was going to be too big of an ask for them, and they immediately said yes. And so there is a second donor that came to the event that has expressed interest in wanting to do more. They just didn't know what it was going to be. I knew this donor family was connected to the Caring House as well, but they hadn't met the new director. And so my intentionality when the donor came in at some point was to make sure I personally took them over, to meet the new director, introduce them, let the director know their involvement in this area in the past and how valued they were to supporting this area. And it was amazing to see instant connection. They were so grateful. And then we took them around to see different areas that were spotlighted. And the very next morning, I get a phone call from this donor and thanking me for inviting them to the event, saying how much her husband was just blown away. And he said, you know, you hear the impact, but I've never been to an event where I got to touch it and see it and actually hear directly from the people that are benefiting. And they have since come alongside us to, because we had the first donor commit, I challenged them with helping come alongside and matching. They didn't at that level yet. They've committed to half of it. And so, but none of these conversations would have been able to take place as quickly and as intentionally if we hadn't had them at the event. And kind of the follow-up after the event being super intentional in the ask.
I was so thrilled for you all and very impressed with, to your point, the intention you had in following up with each of these individuals. You had spoken about this new program director, and I kind of want to go back there for a second because I do think that's important for us all to kind of think about if we're going to put on something like this event that is stewardship focused and we bring in, you know, specialists into the conversation. How did you support them in understanding who was in the space, how to report back to you, who the right person was to share? I mean, this individual knew I need to go to a gift officer. That's fabulous. How did you set them up for success to support your fundraising efforts?
Mm-hmm. When we asked our clinical and program directors to be a part, first of all, they were thrilled. None of them hesitated with a yes. They love to be able to interact and thank our donors in person. And so once they arrived, the evening of, we asked them to come early and we talked them through the layout of the event, reminded them of the purpose. We did not have them prepare anything in terms of an ask, but we wanted them to be well informed that if a donor were to ask what some needs were, or how much a piece of equipment was, then they would be able to articulate that and communicate it. And so then once the event was over, we kind of went around and asked them for feedback, and that's when they gave us the information.
So you built it into the end. It was a part of the event, even though the event itself was done. I love that.
Yes.
Well, great, Anna. I appreciate you kind of sharing those two stories because that's the idea. That's the whole point, is that we get to deepen these relationships with events, and we know major gifts is how we move forward. I am curious. This is your first time with this event. Can you share a little bit from a reflection standpoint? Like, what did you identify as the greatest benefits for your donors that joined you?
Think the scope of what our donors were able to see, and that not they walking away more knowledgeable of our mission, because it's different when you just hear it from a stage, but being able to interact with the different pieces and the people with whom their gifts have made an impact, I think it left a lasting impression, and a valuable pride that they got to be a part of something very meaningful.
Yeah, absolutely. We work really hard to share our stories and we'll incorporate videos and images, and that's a part of successful storytelling. But there is something extra elevated in actually being able to interact.
Mhm.
I'm curious, for your staff that reports to you, that's working alongside you, what did they find the most beneficial from this event?
The first would be the FaceTime that we get to spend with our donors, but the intentional conversations that were had, very targeted conversations, very strategic conversations that naturally came about to kind of really move the needle. and personalize the interaction, not just having conversation and social conversation. It allowed our teams to really highlight donor impact in very individualized ways. But then they were so encouraged by the feedback of donors. I think we had donors, this was not very intentional and we were asking for anything, but as we interacted, donors were saying, how many more of these do you need? How can I get more involved? Is there another need that you have related to this? How much does this cost? And that allowed us post-event, one, we were super encouraged by it, but it gave us very strategic follow-ups with our donors that didn't feel forced and felt very natural.
Yeah, they honestly, they gave you permission to follow
It
up with them.
did.
Interested. Can you tell us just briefly about how your team sort of organized the follow-up? Because that's one thing I want to, celebrate on your behalf is that you didn't end at the event. And that happens. We get so tired. We put all this energy into the event, and then you're like, oh, I just need a break. We don't necessarily reflect. And we sometimes drop the ball on, the really intentional work that comes as a result. Could you share what your team did, please?
Absolutely. One, we had a quick debrief, a very huddle-like debrief. Okay, are there any key conversations that we need to know? And it happened very natural. Hey, I spoke to this person. We really need to follow up. Or they were very engaged and asked these type of questions. And so as our major gift officers very intentionally followed up and went ahead and set up these appointments with the key donors who had a direct interest in making an ask. But then we did some follow-up even with those that couldn't attend by sending them some photos. Or, hey, we were able to spotlight this. I hate that you missed it, but I'd love to be able to tell you more about it when we can get together next. And so not only for those who attended, but those who maybe were unable to attend, we created a virtual gallery that they could experience and walk through themselves, that we could do in person with them and communicate the impact, even though they couldn't be there in person. But I think the most valuable piece was following up immediately with those that expressed an interest during the evening.
Yeah, keep that excitement rolling. And yes, you all had kind of those that attended follow-up and those that couldn't make it. And you were like, I'm not going to leave them out. We put a lot of effort into this. We're going to make sure everybody hears about it. So that was really fabulous. Okay, so if you're here listening and you're like, wow, Anna's amazing, because she is, and that event seems like a huge lift. Anna, I'd like you to share with everyone what you shared with me a couple months ago about how this was great. You're taking pieces of it, but you're going to find ways to integrate what you learned in smaller scale options. Could you tell us a little bit about what you're doing at the State of the Hospital in June?
Absolutely. This was a huge team collaboration and a lot of planning and for the execution of it. And we loved the results. As we debriefed as a team, we thought, what are some ways, the faces of gratitude, or maybe one piece of equipment that we could take to a next event, not at such large of a scale, but we want to incorporate one or two pieces. We have a corporate event coming up in June. And so we're trying to determine will the vein fire or the communication device, it's easy to transport. It's something that is unique and different and would catch attention of our donors and articulate just some of the high technologies that we're able to support through their support. And then even we have a fundraiser. I don't think Michaela told you about this. We have a fundraiser in the end of July for our neonatal ICU. And so the Faces of Gratitude we're transforming into our neonatal graduates. And so our donors are to walk into the event and see 20 years of graduate faces that they've been able to support as they walk into the event. And so we're not doing it as large of a scale, but the things that we learned, we're trying to take little pieces of it that we can do each event. And then we're looking at, okay, in the future, this isn't something we will do annually, but from the feedback, can we incorporate it every 3 years? And then that allows us in between that time frame to like capture those storytelling pieces, identify it. What are the things that we need to go ahead and kind of have in the back of our minds so that when it comes time to execute, we know how to do it and we have everything at our fingertips. Um,
Yeah,
yeah.
no, that's great. I love to the whole point of today's session, working smarter and trying to avoid burnout, but still pursuing those highly engaging opportunities for our donors. So thank you so much, Anna, for sharing all this with us. I'm going to move to Anna's contact information. You are welcome as you kind of digest this information to reach out to her. Just, with whatever question about how she structured this event. But are there any immediate questions that we could maybe answer while she's here with us today? Right. That's perfectly fine. It's a lot of information. Well, thank you again, Anna. It's always a joy to hear from you, and I love looking at the photographs. Marty, would you close us out and tell us about some of the events coming up?
Yes, thank you, Michaela, and thank you so much, Anna, for sharing. It's so helpful. I just could think about little things that I've done in the past and how, gosh, that could have been better with that. And I think when we can share with each other, it's so helpful. So thank you for taking the time and sharing your experience, your real life experience with us. Appreciate it so much. If anyone is interested in talking with a member of the Pride team on how we can help, scan that QR code. We're always here, always looking at ways to collaborate. Appreciate your interest in today's session. We have more sessions just like this coming up.